Before we dive in, a quick note. We are brand new to this and we're still figuring out our equipment. So the audio quality on these first few episodes may not be perfect. We appreciate your patience while we work out the kinks, and we promise we will get better. Welcome back to the dark side of healthcare, the spin-off of Behind the Business of Healthcare, where my background in criminal justice and healthcare administration finally get to work together. Audio only, as always. Minimize the screen, pop in your earbuds, and just listen. My co-host, Dena, is back with me. Dena and I worked alongside each other for 19 years before any of this existed. Welcome, Dena.
Thank you.
And welcome, Holly,
Hey.
our resident true crime and movie buff.
That's right.
Yeah.
I can't wait to see what movies will come out today.
I know, right? If you haven't heard episode 1 yet, go back and start there. You'll get the reference to Holly being a
Few
true
Good
crime
Men.
and a movie buff.
Or Aaron Brockovich. I wonder what we can have.
Yeah, right? Well, who knows? You might be able to pull some things out. We went deep on prior authorization abuse, the algorithmic denial machine, and the delay, deny, defend strategy. Today connects us directly to all of it again. Also, if you end up hearing some dogs barking, we have 2 cute, adorable members of this household that do not like being ignored. So you will once in a while hear them bark.
They have a voice too.
They do. They have an opinion on this.
They
I just
just
don't know
aren't
how
very
to, I
good
just don't know how to translate it. All right, let's get into it. Right now, today, more than 54% of all Medicare enrollees are not on traditional Medicare. They're on Medicare Advantage, a private insurance product run by companies like United Healthcare, Humana, Aetna, Cigna.
Okay, wait. They are on Medicare, but they are not on Medicare.
Correct. Kind of.
Okay, keep
We're
going.
going to get into the meat of this.
We hope to make more sense of that.
Yes, we're gonna tell you how this is happening. Okay, so they have these Medicare Advantage plans through private insurance companies, and they're sold to them in many cases by a salesperson. So a patient has a salesperson who comes in and sits at their kitchen table. They're calling them on their phone during dinner. You know how many times Dad would be like, why do they have to call during dinner?
And that's at 4:00 for these patients.
Yeah, exactly. Right? That's right. Or mailing them something that looked like it was officially from the government. It looks like it's from Medicare, right? And here's what those 54% of these seniors were almost certainly not told when they signed up. Okay, so this is what they weren't told.
Yeah.
The insurance company running their Medicare Advantage plan does not have to follow Medicare's medical policy guidelines.
And this is why we have grumpy old men.
There's
my movie.
There's your movie.
Yeah, there you go.
Another old one that if you are, younger than 30, you won't have any reference
You won't
to.
understand that reference. They get to write their own coverage rules. They get to decide what is covered and what isn't. They are being paid by the federal government based on how sick their enrollees appear to be on paper, which means the sicker they can make a patient look, the more money they get from the government. Okay, so the government pays these private commercial payers money for whoever they have on their Med Advantage plans.
And the money that they're getting is false represented because the patient thinks they're getting covered like they would under Medicaid or
Under
Medicare.
Medicare.
Sorry,
So,
Medicare.
yeah,
Traditional.
There's going to be 2 sides to this story.
Yeah.
So, yep, we're going to totally get into all of it. Meanwhile, on the back end, the game is to pay out as little as possible on the care you actually need. Now, if you listened to episode 1, you're going to hear all about how there were claims that were just automatically denied or prior auths that were automatically denied, and those patients were on Medicare Advantage plans.
Is this Groundhog Day?
It might feel like it.
Another one.
Yeah, it might feel like it. So overbill the government on the front end, underpay for care on the back end. right? Pretty sweet gig they got
I was
going.
going to say, it's a good business plan for them.
Yeah, they're getting a check no matter what.
Right?
Yeah.
But we're going to get into the whole fraud side of it.
Because remember, we're focusing on how this impacts the
care
end user.
And the end user and how it's a crime. Like what's happening in the system that's criminal, right? This is the Medicare Advantage business model. And the Department of Justice has spent the last several years proving it to the tune of billions of dollars.
That was a billions with a
Billions
B.
with a B in settlements from some of the most recognizable names in American healthcare. Okay. So that means the government has found that these insurance companies are making their patients look sicker on paper than they really are. So they get more money from the government. And they also know that they're not providing care to the patient.
Right.
And the patient's also paying those insurance companies to have that plan too. So they're getting money from the patient. Okay. Dena, before we get into the fraud side of things, I want people to understand what Medicare Advantage actually feels like from the inside of the fight, because you deal with this plan, like these plans, every single day. So when a patient comes, I was gonna say, I'll get my.
You get it in there.
I'll get into my detailed question for you. When a patient comes to you and is covered by Medicare Advantage versus traditional Medicare, what's your immediate response first? Like what's your gut response to that? What's the immediate difference you feel in the terms of what you're walking into? Because it's completely different for you to deal with a Medicare Advantage plan patient than Medicare.
So of course, I would prefer not to. First off, that was my gut response.
You'd prefer not to deal with the Medicare Advantage
of
person.
Course. Yes. Right off the bat, I know I'm going to have stumbling blocks with them that I wouldn't have with a traditional Medicare, plan.
Okay. So give us an example.
Well, there'll be more surprises with a claim.
Okay.
There's
on the back end.
On the back end, they can say that there's no authorization required. And with Medicare, that would be true. But with a Med Advantage plan, that may not be true. So you should be getting some type of review to secure that claim.
Okay. So give us an example. Like, give us, just a condition example, like without being specific. You don't have to say with this specific payer, this is what happened, but give us kind of a specific example where you've seen a Med Advantage patient and kind of like how you said on the back end, not get something paid for that. If they would have had traditional Medicare, it would have been covered.
Well, I think the first time that this happened, I was surprised, and I shouldn't have been so surprised. But a patient who required a vertebroplasty, I've mentioned that before.
Yeah, in episode 1.
A traditional Medicare patient would have been having the procedure next day, meeting the criteria, in Medicare's policy.
Medicare expects you to know the policy.
Yeah, you know the policy. It's out there for you. You know that they're meeting that. So you could schedule them the very next day for this procedure. You call an Advantage plan. And I don't need to be specific of one because each one of them have that. Most of them are that way. They will then say, well, this is going to require review. So right there's 3 days or so because you have to take the time to get it reviewed. We've talked before about escalate. This would be one escalated for pain. And so you could probably get it through quicker than the 15 days. But at one point, I had a denial for a patient on this procedure, and I was shocked. And I said to the representative, how can that be? They are meeting Medicare's policy, traditional Medicare policy. How can this be denied? Is there something missing in the clinical that didn't get reviewed? Is there something I can update? I saw that everything was there. But the response was, well, because we are also a commercial plan, we do follow Medicare guidelines, but we can also implement some of our own guidelines. My jaw dropped. I was
there it is,
shocked.
folks. There it is.
Okay, so do you know what this reminds me of? We always get those warnings for our elderly to caution them against scams. We've all seen them lately around on our text that the state DMV is going to pull your license if you don't pay your fine, and you're like, what fine? And it's all a scam. I
can honestly tell you, our mom should have her license pulled.
I know that she might be listening. Yeah. No, but I mean, we have all these warnings for elderly about be cautious of these scams. Don't fall for the click this button on your computer. Don't right? And yet this sounds like it's something that
Yeah, but
is
you actually,
scam-like.
like a scam, you don't have a person physically in your house saying, this is what you should sign up for.
Right. And
This
that's why I think this is
the
even
best
worse.
thing for you.
That's why I think this is even
And yet
worse.
it's not a scam because Medicare is paying them
Paying
to
them.
operate.
Right.
Yeah,
That's why
exactly.
it's wrong.
But they're not being.
That's why this is fraudulent. This is why this is being reviewed on the dark side of healthcare.
It makes me think about that because I do everything I can to protect my mother from falling from scams. And when you do have somebody in your house calling you on the phone, talking or come into our office and we'll talk with you.
Mm-hmm.
You think you're going to trust that person. They wouldn't want.
Honestly, yeah, why wouldn't they?
Yeah.
I mean, I think that both Dena and I have talked about this with our parents. When mom and dad were signing up for insurance, dad asked me point blank, should we do a Med Advantage plan or should we do Medicare and supplement? And I said, you do not do a Med Advantage plan. You better just pay the extra to do the supplement.
But they had you who worked in the medical field.
Dena did the same thing for her mom.
Well, I did the same thing for my mom. And actually, we had a year where she was convinced that the Med Advantage plan was the way to go.
Yeah.
We tried it that year. And guess what I was doing the next year?
Getting her back on traditional Medicare.
Getting her right back
Sometimes
on.
that's hard. We're going to get into that a little bit because sometimes patients kind of get stuck and they aren't allowed to get back on
and
Medicare.
Get stuck.
Wow.
You need the right person there to get you back on. And that's not going to be
everyday
so
person.
We'll get into
everyday
that.
person.
Yep, we'll get into that. But like everything we cover on this show, I do want to give it credit because originally there was a reason that Med Advantage plans were created. There was
had to be. It's called an
positive.
advantage. It's in their name.
Yeah. There was an advantage at some point. Okay. So because the gap between what Medicare Advantage was supposed to be and what it became is exactly what makes this story so dark. The original idea, going back to the Balanced Budget Act of 1997 and expanded under the Medicare Modernization Act of 2003, was actually reasonable. Okay, the plan was reasonable. Let private insurers compete for Medicare enrollees, give seniors more choices and potentially more benefits, dental, vision, even gym memberships, things that traditional Medicare doesn't cover. And if the private sector delivers care more efficiently, everyone wins.
Yeah.
So that's the pitch, right? There's the pitch. And for some beneficiaries in some plans in some parts of the country, it actually does work. And I want to be honest about that. It's not corrupt everywhere, okay? But payment structures built to make Medicare Advantage work created an almost irresistible incentive for fraud.
The dollar sign.
Yeah, right?
Always.
I
Mighty
mean, it's
dollar.
kind of like there's always this, good intention, but it's sometimes those who are going to find a loophole are going to find a loophole. Here's how it works. The federal government pays Medicare Advantage plans a fixed monthly amount per enrollee. It's called a capitated rate, okay? That rate is adjusted based on something called a risk score. The sicker your enrollees appear on paper, the higher your risk score. And the more money that CMS, which is Medicare, pays you per member per month.
Okay, so so I'm going to have you pause for a minute because when I'm thinking about my insurance at my age, I'm not on Medicare.
Right.
I want to show myself to be healthier because then my premiums are lower and they're more likely to cover me. So what you're saying is by the time you get to Medicare though, you want to be sicker you are?
No, this is not the patient doesn't want to be sicker. This is not the patient. This is the insurance company.
Me
exactly.
To be sicker.
The insurance company wants you to be sicker because they will get more money for you being on their plan.
And do they have to prove?
That's where we kind of get into the whole like this.
I'll sit back.
This gets dark. This gets darker, right? Okay. So if you are a Medicare Advantage plan trying to maximize revenue, the single most powerful lever you have is making your members look as sick as possible on paper, not actually treating them though, right? Not improving their health, just documenting as many diagnoses as possible, whether those diagnoses are clinically supported or not, okay? That practice has a name. It's called risk score manipulation. and it has generated billions of dollars in fraudulent payments to some of the largest health insurers in the country.
Okay, so if I'm a person on Medicare and I've signed up with one of these Medicare Advantage plans, can I see in my account what they have declared are my risk factors? Like, do I have access to all of that?
You have access
You have
always
access
to the
to your-
clinical
yeah, to
from
your
the
clinical.
provider's office.
Right, but that's not what this is coming
But
from.
depending,
It is because what's happening, and we'll get into it, is that providers are actually being pressured to
Come up with a list
come
of
up to add
illnesses.
more diagnoses to their patients' clinical.
there's certain scoring and so many diagnoses that are required for a claim to be paid. All it's doing is making the patient look more sick.
Yeah.
And it's not benefiting the patient in getting anything paid for them. It's not benefiting the clinic. It is only benefiting the Advantage plans. The more kickback they'll get from Medicare
Yeah.
or from the government.
Which is basically what you just basically answered the question I was going to ask you. So that's exactly what it is. So let's get specific. It's okay. Holly's going to let the dogs in. So if you get to hear more of, they're adorable, guys. Sorry, you're not going to see a picture of them. Bandit and Cassidy. They're just outraged by this topic that we're talking about.
Either that or somebody's mowing their lawn.
Yeah, exactly. Or the kids are out in the neighborhood playing. So once they both come in, we'll shut the door. All right. Okay. So let's get specific because this isn't allegations or suspicion, right? Like this is settled law and 9-figure checks written by the federal government, like to the federal government.
9 figures.
9 figures. That's where the billions comes in, right?
That's too many for me to know.
Right?
I haven't seen a check with that
No,
number.
I don't think
I've
anybody.
never
I don't
in
think any
my
of us have
life.
seen a check like that. Exactly.
I'd like to see one with 5 digits.
I'd like to see one with 4. In January 2026, so just a few months ago, guys, like this year, okay, Kaiser Permanente settled a Medicare Advantage risk adjustment fraud case for $556 million. Okay, so not the billions, but in the millions, okay?
That's a 6-digit.
Yeah.
No,
Yeah.
yeah,
Yeah,
no.
it's more because it's
It's
556 million.
million. Yeah.
Okay. That is the largest False Claim Act settlement involving Medicare Advantage risk or fraud in history. Wow. The government's allegations were specific. Kaiser developed internal systems to mine patient records for diagnoses that hadn't been submitted and then sent what they called queries to providers and encouraged them to add those diagnoses through medical record addendums, sometimes to patients that they hadn't seen in over a year.
Okay, so let's go back. First of all, that's 9 digits. I just want to make sure I did that.
So there you go.
But where did that 9-digit figure go to? Did it go to the government?
Yeah. They had to pay back the government.
They had to pay. So the government, because that's
they,
who had paid them.
they defrauded the government. So they're paying back the government.
Yeah.
Okay. But it's because they queried physicians and asked them, out of these diagnoses, they should probably apply to your patient.
And I haven't even seen this patient.
Probably just went through and checked. Okay, yeah, they probably, sure they have this. Sent it back in. Hadn't seen patient in over a year.
Yeah.
Okay. In other words, they had to go back to the chart and add and not seeing, a patient. That's the largest settlement. Here's the list. Here's the list behind like the rest of them that are going on right now. Cigna, which we talked about Cigna from episode 1. You're going to see some of these repeat offenders. Okay. Cigna, 172 million in 2023. These are all payments back to the government. Okay. Cause they all defrauded the government.
Right.
Independent Health and its CEO. So not just the insurance company, but they also got money from the CEO. Up to $98 million in 2024. And the CEO had to personally pay $2 million out of her own pocket. Oak Street Health, $60 million in September of 2024. CVS Aetna subsidiaries, 118 million settled in 2026, with the DOJ alleging that Aetna paid coders to mine records for diagnoses that weren't clinically supported and then knowingly submitted false obesity codes for patients whose own BMI data showed they weren't obese.
Wow. So then that goes even further, because then we see those commercials and those stories about America's the most obese country in the world. And yet, what is the data?
Where are they getting the data from, right? Yeah. Exactly. I mean, now, granted, I do believe we do have a problem here in America. Right. But yeah, exactly. Where's the data coming from? How can you trust the data? Right. How can you even trust the data? And then, of course, United Healthcare, our top offender, the largest Medicare Advantage insurer in the country. There is an active federal litigation, United States versus United Healthcare Group, working through the courts right now. The DOJ has alleged systematic risk score inflation at a massive scale. That case is still moving. That case has the potential of paying out even more than what Kaiser Permanente paid. Okay? The total False Claim Act settlements in Medicare and Medicaid fraud for fiscal year 2023 alone came to $2.6 billion.
Almost $3 billion.
Almost $3 billion. The DOJ has publicly called Medicare Advantage risk adjustment fraud an area, and this is in their own words, critical importance. That's pretty. I don't know if people realize that when the government says that something's critical that they're reviewing, it's a big deal that they're reviewing it, right? So here's what I want people to understand, because I think that this is part that makes people's heads explode, right? The same plan that is inflating risk scores to collect more federal money is also the plan that is denying prior authorizations on the back end.
Okay, going back to our first episode.
Yeah, right? Walking people through, like Dena, walk people through what this looks like from where you sit. The same company, two completely opposite behaviors depending on what direction the money's flowing.
Well, so it's not fair. I mean,
you're like, what else can I say?
But that's like a 5-year-old's excuse.
Right, I'm sorry, but it's just not fair. And
I'm taking my ball home.
And I think I've said before, we can never use those excuses or reasons. Those never hold up anywhere in the insurance world. But they're just, in my opinion, aren't they just looking for the easy dollar?
Yeah.
They want to get that patient who looks sick on paper and they're getting reimbursed more. But they're not about ready to pay out for a procedure.
They're not.
And so all they do is hold up that care. And I've often wondered why an insurance company should ever be making as much as they are. You know, I have said that before.
Oh, I completely agree. I know you've said it. So when you hear the settlement numbers, right? The 556 million, the 172 million, 118 million, does it feel like accountability? Like, do you feel like that because they're now having to pay that back that they're going to be held accountable? They're going to change their ways? Or do you think that the insurance companies look at this as this is just the cost of doing business?
I would have to say they're looking at it as this is just the cost of business.
They're going to run the risk. They're going to run the risk of not getting caught.
They don't get caught back up in this, and they'll recoup it somehow, some way.
Yeah.
So
yeah.
And until it's just like you said at the beginning of this podcast, is just basically, aren't we supposed to be watching out for scams? Yeah. It almost looks like from everything Heather just reported to us, it's just scam.
Yeah.
Well, you would think,
but nothing is changing.
Nothing's changing.
One company who just watched another one be charged with, what was it, 568 million?
556.
Oh, sorry, 556 million. Another company would go, well, maybe I should clean up my practices because I don't want to have to pay that out. I only had to pay 172 million.
Right.
So we're not anywhere near.
Well, and as Dena said, they're calculating the risk and they're deciding it's worth it to still do fraud because they're hoping they won't get caught.
Yeah. Well, isn't that how every criminal acts?
Yeah,
exactly.
The payout of robbing the bank might
if I get away with
be better than the consequence if I get away with it.
If I get away with it. Exactly.
Breaking into that house will be better if I don't get caught than if I don't.
Yeah.
I mean, every criminal mindset is can I get away with it?
So now I want us to take a step back from the federal fraud story, okay? Because everything I just described, the risk score manipulation, the DOJ settlement, the billions in fraudulent payments, that is a government problem. That's a taxpayer problem.
That's my problem.
That is, that's all of our problems, okay? But what I'm about to describe is your problem, and it's your parents' problem, and it's your grandparents' problem. Okay, you've already talked about how that this is like you have caregivers, right? Medicare Advantage now covers more than half of all Medicare beneficiaries. That didn't happen by accident. It happened because one of the most aggressive, most incentivized, and the federal government's own investigators now agree, the most deceptive sales operation in American consumer finance. And here's the pitch. You're turning 65. You're getting a flood of mail. Some of it's designed to look like it's from the Social Security Administration or Medicare itself. You're getting phone calls. Maybe someone comes to your home or sets up a table at the pharmacy or your grocery store. And the pitch sounds incredible. Lower premiums than a Medicare supplement, $0 premiums on some cases, dental coverage, vision coverage, gym membership included. It sounds like you're getting more for less. Okay? Here is what the salesperson is legally allowed not to tell you. The commercial insurance company running this plan does not have to follow Medicare policy guidelines. Medicare has established over decades what treatments are medically necessary and covered for which conditions. Medicare Advantage plans write their own coverage policies. Dena just barely talked about this at the beginning of the podcast. They get to decide what's in and what's out. And their decisions are driven not by Medicare's clinical standards, but by their own financial calculations. That specialist you've been seeing for 10 years may not be in network. That skilled nursing facility your doctor recommends after your surgery, their plan may not cover like traditional Medicare. The cancer treatment your oncologist ordered, it may require a prior authorization that gets denied in 1.2 seconds.
Quicker than what we just said.
Because of the algorithm. If you listen to episode 1, you know what we're talking about. And here's the exit trap that almost nobody mentions at the sales table. And this is what I was just talking about with Dena. If you enroll in Medicare Advantage and later want to go back to traditional Medicare with a supplement, you may not be able to get one. In most states, insurance companies offering Medigap supplement policies can deny you coverage or charge dramatically higher premiums because on your health status, if you're coming from a Medicare Advantage plan after your initial enrollment window, you are not guaranteed the right to go back.
And why is that? If I'm willing to pay for it, why can they?
Well, how do they know how sick you really are?
That's what I was just going to say. Is it because they're looking at my record and they're like, we don't know if all this information on here is accurate?
And Medicare and Medicare supplement plans know the corruption. They know what's been getting submitted. So how do they trust? Right. Are you really that sick or not? Are we going to be paying out a ton on you or not?
Right.
Are we paying less just to pay Medicare Advantage?
So it goes
does Medicare traditional really want to take you back?
Yeah. Goes back to what I was saying a few minutes ago about when I'm trying to get my insurance at my age, I want to look as healthy as I can so that I can get covered. And now they're looking at my record because I was on this Advantage plan and they're like, I can't trust this record. You might be as healthy as you've ever been, but I can't trust this record that shows that you've got these 10 diagnoses.
Yeah, exactly. So the Senate Finance Committee published a report in 2022 documenting the scale of this problem. Deceptive mailers, misleading claims, agents enrolling seniors in new plans without them even telling them. Okay.
Okay, wait. Whoa, wait. Enrolling without, how do you get enrolled in a plan?
Because a lot of patients trust their insurance salesperson
to just do it.
A lot of these salesmen come in and some of them are unfortunately friends of neighbors. They're
right.
They're
so I'm going to trust
them. I was referred to you to trust that you have my best interest at heart. So I'm going to trust what you're telling me. And so then that provider, like that insurance salesperson, I'm not saying everyone's corrupt out there, but there are some that are corrupt out there. When it comes time for re-enrolling, they're just going to tell you that, you just renewed, and then you get your new cards in the mail, and you're now on a Med Advantage plan that you didn't know, but you think that, well, that's just what
I was just re-enrolled
to do.
Yeah,
but it's the plan that they're going to get
the most money from.
Mm-hmm.
Exactly. Your salesperson, that salesperson is incentivized to put you on a Med Advantage plan. They're getting money. They're getting a kickback.
Right. Yeah.
So they're incentivized to put you on that.
They're doing their research of this is the plan that's going to pay me the most for this particular patient. And so I want to move this patient over to here.
Exactly.
And then they
Yeah.
just go ahead and do it. Because I've re-enrolled you. I just didn't
I took
re-enroll
care
you
of
in
you.
the same
Yeah.
plan.
This plan will be great for you.
Exactly. And in between 2020 and 2021, like I think that they said that it doubled, like the beneficiary complaints doubled. So
Yeah.
there was that many that were manipulating,
Wow.
and signing up people for plans that they didn't know about. So in March 2025, a Senate investigation found rapid growth in spending on marketing middlemen, third-party organizations whose entire business model is generating Medicare Advantage leads and selling seniors contact information, sometimes multiple times to multiple brokers without the senior's knowledge. In July of 2025, the HHS Office of Inspector General announced a formal investigation specifically into misleading Medicare Advantage marketing practices. The government is investigating its own program. So this is the government who is investigating its own program.
How often do you hear the government
Right?
investigating the government?
They don't do that. So it tells you how bad this has gotten. So Dena, when you're working with a Medicare Advantage patient who's in the middle of a denial or hitting a coverage gap they didn't expect, do you ever hear the story of that this was supposed to be a better plan for them? Like that they were pitched that this was the right thing to do and now they regret it?
Well, I think at first it's harder for them to believe someone like me than it is for someone.
You don't know what you're talking about.
I know. I have no skin in the game. And I am telling them that their, agent didn't fully inform them.
Well, and actually they're telling you probably your skin in the game is you're just trying to get more money for your clinic.
Right. You just, you
right?
want this
You just
or that.
want it, yeah.
But yet at the same time, why would I tell you that it was denied if I want, more money for the clinic?
Yeah. I mean, at our clinic, at least, we wouldn't turn around and say it's denied, so turn around and pay this yourself.
Yeah.
Like, I mean, we would basically say, with your prior auth, it was denied. We're not going to ask you to go into a procedure that's going to cost you $20,000.
Right. And they're just usually saying, well, this is the one that my agent said was best for me, or they just sign me up. All the things that we discussed.
Yeah.
There have been times that they'll actually call their insurance agent and say, I'm being told by so-and-so that this is not covered, or that I owe this much for some imaging.
Yeah.
I don't understand why I owe more. I thought everything was going to be a copay.
Yeah, some patients were left with like $150 for imaging that they didn't even know.
On top of
what they had to pay.
It was a surprise to them. So it's all those surprises with the Med Advantage plan that, once again, I don't... How does a patient even understand everything that's covered and at what? Even those with us with commercial plans, right? Are we always reading what's included or not?
I just went to the doctor yesterday, and my thing, I changed insurance because I changed employers, and my thing was, I have no idea what my copay is.
Yeah.
And I feel like I'm a pretty educated and with it person, and yet it didn't dawn on me until I was walking into the doctor's office.
When they're going to say, okay, let's, how much is what's your copay?
And I'm like, I looked at my card and it doesn't say it. And I started.
Well, thank goodness most doctor's offices nowadays, they do their job and
so
they
get their money.
Yeah, they do your benefits. Like they verify your benefits before you even walked in the door. So they can tell you your copay is $50.
Yeah. My whole thing is, how do we expect these older individuals to keep up on all of the things that they need to know when we as everyday working people
we can't? And even those of us who work in the industry, we're still only kind of staying up to date with what our practice does and what that insurance means.
Right. I mean, we were going to have a business. We had a business model on this, like where we were talking about, we are going to go into business and we are going to start educating all of these patients about what, what is their insurance, telling them,
for a small fee. We're not trying to sell insurance.
We were just going to go and say, okay, this is what your EOB is saying. This is what you should be fighting. Like, because you kind of need somebody in your corner. And I can tell you the salesperson is not in your corner.
No,
so
they're
we
not
were going to do a business.
And they're not going to read all the fine print either and know what's...
In fact, they're probably hiding some of the fine print.
Oh, sure. So that they can, this is a great plan for you.
Yeah.
Yeah.
And, some of these Med Advantage plans come with a low to no premium. So it looks really good on paper.
Because supplements are more money.
And to a fixed income person.
Yeah. That sounds fantastic.
That sounds great.
Until the first time they may end up in the hospital or they may get some imaging and then suddenly... Well, how am I going to pay that?
How am I going to pay for this?
Yeah, that's a surprise.
Especially if they have a condition that requires a lot of imaging.
Ongoing. Or in an ongoing treatment plan.
Yep, exactly. So that's why this channel exists, folks, because we are in your corner.
I'm just here for the commentary.
You're in their corner too.
I am.
I'm in
because
their corner.
I'm shocked. It really is shocking to hear how deceitful a company or companies that are supposed to be in my corner are, because they're not.
No,
They're not.
They
Exactly.
aren't.
So I want to get specific about the coverage gap because they write their own rules is abstract until you're a patient sitting in the hospital bed, right? Because that doesn't really make sense when it's like, well, like we get to write our own policies. So traditional Medicare, Parts A and B, is governed by national coverage determinations and local coverage determinations, clinical policies developed by CMS based on medical evidence. They establish what is and isn't covered, and they apply consistently across the country. Medicare Advantage plans are not bound by those determinations in the same way. They must cover what traditional Medicare covers at a minimum, in theory, but they can impose additional prior authorization requirements, additional step therapy requirements, narrower networks, and their own coverage criteria on top of the Medicare baseline. That's kind of when Dena's jaw dropped about how the patient couldn't get their vertebroplasty, which means in practice, a procedure that traditional Medicare would pay for without a prior authorization with your doctor of choice at any Medicare participating facility, a Medicare Advantage plan can require prior authorization for, deny under their own coverage criteria, require you to try a cheaper alternative first, and limit it to an in-network provider that may not even be your doctor. And the investigational denial that Dena and I talked about in episode 1, where a payer calls a proven procedure investigational to avoid paying for it, that happens at higher rates in Medicare Advantage than in traditional Medicare, because Medicare Advantage plans have the flexibility to define investigational more than broad CMS, right? So what is the coverage gap you see Medicare Advantage patients hit most often in? Like what's one that comes up in, again and again, Dena, in your mind, like what patients generally did not know that they were walking into that, that you see, okay, like this is usually covered by Medicare, but Medicare Advantage isn't going to cover this for you.
I think it's pretty much what we've discussed.
Yeah,
is that
it's a repeat. We're broken record.
Well, but it's good to get that information out there and have them understand that with Medicare, there's policies that are written that offices and hospitals can follow and know that they're meeting these things so that it's covered, it's paid, and then you'll have your supplement to pick up the difference.
Right.
Where with the Advantage plans, there are just a lot of surprises because they can kind of write things as they go. Sure, it's maybe in the fine print that nobody's looking at, but they can also just make up their own policies.
Make up their own. Yeah.
I'm going to start making up my own policies and get paid by the government.
I like it. I don't think that you're that savvy. So I don't know. I don't think you're that criminally like you like true crime, but you're honest.
Wait a minute. I have learned how to bury a body and let nobody know where it's at.
I don't think you're supposed to share that.
I'm not supposed to share that on here. Sorry.
That should be quiet.
Okay, I never would because I don't want to do the physical labor of digging the hole.
And I think a lot of people now, totally off subject, feel that way. But I'd like to see some really
try to get
pull it off. No, I don't want to see that. But
oh wait, I think there's plenty of cases that we're listening to on true crime.
Yeah,
that they think they got away with.
I think there's a lot of Dateline shows where people have thought that the same thing. That I've watched enough true crime, I know how to get away with it, and they still don't get away with it.
Yeah, exactly.
So yeah. All right, so let's get into. I want to speak directly to anyone listening who's approaching the Medicare age, okay? And who has a parent or a grandparent navigating this decision right now, because the system is designed to make Medicare Advantage look like it's the obvious choice. And for some people, in some circumstances, it may be. I'm not trying to say that Med Advantage plans are not good for certain patients,
right?
Okay? But you need to go in with your eyes open. Here's what the salesperson may not tell you. 1, your network matters more than you think. Before you enroll, verify that your current doctor, your current specialist, or your preferred hospital, facilities, whatever, that they're in network.
I think about this one with like some of our rural locations. They have only one medical clinic or they only have one hospital. Their only choice is to go to that place or be several miles away from care.
Yeah.
And if their provider is
there
not.
are some protections, thank goodness. In
Oh,
that,
good.
because
There
there
are.
some protections for rural communities.
Oh, good.
That you can, if that doctor or that hospital is technically out of network for what's typical for that insurance. So say you have Blue Cross, Med Advantage. A lot of Blue Crosses around here in our state specifically can't go to one of the particular health organizations, but because if you live in the rural area, you actually can go to that entity.
I work in a lot of rural areas, and I like Manila out in the middle of nowhere has no medical facility within an hour's drive. They have a medical clinic.
Right.
You'd hate for that medical clinic to not be covered.
Exactly.
And they have a lot of
and thank goodness
Medicare.
that there are those
Yes.
exemptions or whatever it is, because of the fact that how do you even entice providers to go out to a rural area if they're not going to get paid?
One thing that's actually working.
One thing that is working.
Oh, good.
Woo, let's celebrate it. One thing that's working.
But then on the flip side of that, you think of the big cities and you think, I have all the options in the world.
But you don't.
And you really don't.
You don't.
Exactly. Number 2, look at the prior authorization requirements before you sign. Ask specifically about the services you currently use. If you have a chronic condition, a recurring procedure, or a specialist you see regularly, ask whether those require prior authorization under the plan. Plans are now required to publish their denial and approval rates. Use that data.
So I'm thinking about all of the diabetics that have been denied treatment. And it is making me wonder how many of them are on one of these
plans,
these Advantage plans that
possibly. I was going to say, are you talking about they're getting denied like their medication?
Because their insulin.
That's something new that, once again, government finally did something about it.
Mm-hmm.
But
it's
the
only been the
government
last
had to
couple
step
of
in.
years.
It's only been within the last couple of years the government finally stepped in and said, you can't be charging this exorbitant amount of money for patients to have to pay for their insulin.
Right. Yeah. But it took an act of government to change that.
Yeah, exactly. Yeah.
We need some more of that.
Yeah, we do. 3, understand the out-of-pocket maximum and what counts towards it. Medicare Advantage plans have annual out-of-pocket maximums. Traditional Medicare does not without a supplement. It's catastrophic. If in a catastrophic year, that gap matters enormously. But read the fine print. Not all services count towards the cap in all plans. So you could end up being stuck with more. 4, understand the exit cost before you enroll. If you want to return to traditional Medicare with a Medigap supplement after your initial enrollment period, most states do not guarantee your right to purchase a supplement at a standard rate, regardless of your health status. You may be medically underwritten. You may be denied. You need to know this going in. And 5, if you are already on Medicare Advantage, you are being denied care that you believe is medically necessary, you have rights. You can request a peer-to-peer review. You can appeal. You can request an expedited appeal for urgent situations. And if the plan denies your appeal, you can request an independent review entity. That's that third party
we talked about. Yeah.
Mm-hmm. It's an outside reviewer contracted by CMS, not the insurance company. That reviewer is free, and plans lose a meaningful percentage of those external reviews. So there's your incentive right there to do it, because a lot of them lose. Like a lot of the Med Advantage plans are losing those.
That's awesome.
The system is counting on you not knowing that, though.
Mm-hmm.
That's why we're here.
That's why we're here. So for someone who is on Medicare Advantage plan right now and is sitting in a denial they believe is wrong, walk them through what that fight looks like.
Well, it's going to mean them being proactive.
They have to be involved.
And I personally feel like they should pull their agent in. I feel like their agent should be able to help call the insurance.
Their agent should have to be stuck with helping with
so
this.
That's what my question is. Okay, the agent is doing the wheeling and dealing.
Right.
It's almost like a drug dealer.
In a way.
Right, in a way. I mean, I don't want to call them druggies, but they're trying to find the next best fix for them.
So
Where
they should,
is their liability in all this?
Yeah.
in my
when we're
opinion,
question.
you call them with the case number and you ask them to call
You
the
make their
insurance.
life miserable
Because when we're talking
your
about
own life is
where
miserable.
the system is breaking
Yeah.
down, it's the agents that right now are the breakdown.
You hold them accountable.
We keep feeding the agent. I mean, not that it's the same, but when you look at prostitutes being charged, if there was nobody hiring prostitutes,
Right.
there wouldn't be
Holly's bringing in another crime angle.
right. but the idea is we sometimes go against the wrong entity.
Right.
Yeah,
Maybe we
that's
need to
true.
be going against the agents, just like we needed to be going against the Johns.
Yeah.
Yeah. somebody needs to just be educating them
That's-
about
yeah.
the
We're
plans.
going to put that on a t-shirt. Go after the agents just
like you
they
go after the Johns.
You'd have to put insurance.
I know, that's true. That's true. Insurance agents. Yeah, we might have to start coming up with our own products, man.
That's what I'm here for.
That's a bumper sticker right there.
That's hilarious. And no, that's really where the fight would start, in my opinion. Then working with the office and the denial, and also getting involved with your insurance plan.
Yeah, I agree. I absolutely agree. Medicare Advantage was sold to Washington as a way to bring private sector efficiency to Medicare. And what the DOJ settlements are showing us, case by case, billion by billion, is what that efficiency actually looks like. Inflate the risk scores, collect the federal payment, write your own coverage rules, deny the claims, and hire enough salespeople to keep the enrollment numbers growing faster than scrutiny can catch up. Kaiser Permanente, Cigna, Aetna, United Healthcare, Independent Health, Oak Street Health. These are not fringe operators. These are the household names your parents trust. The plans being advertised during every commercial break on daytime television. The ones sending the mail that looks like it came from Medicare itself. The government is paying attention now. The DOJ is calling this a critical priority. The OIG is investigating the sales practices. Congress has been holding hearings, but the enrollments keep growing. Over 54% of Medicare beneficiaries and rising, which means millions of seniors are making this decision right now, this enrollment season, with incomplete information. If this episode helped one person ask a better question before they sign up, or helped one family member understand why their parents' coverage isn't working the way that they were told it would, that's the point of this series. Dena, Holly, 2 episodes in.
Congratulations.
Yeah, woo-hoo. But I'm still shocked.
Yeah, I think that we're going to continue to shock her. Subscribe to Behind the Business of Healthcare so that you don't miss any of the episodes that kind of set the scene. We kind of go over the practices, the policies, the definitions in Behind the Business, but the dark side is going to tell you about all the crime. It's going to tell you how this is happening and why it's happening. So share this one specifically with anyone you know who's navigating Medicare decisions right now. They need to hear this. And we'll see you guys on the next one, because there's always more.
Bye.
Bye for now.
Thank you for listening to The Dark Side of Healthcare, presented by Behind the Business of Healthcare.